Measles is a highly contagious viral disease that primarily affects the respiratory system. It is caused by the measles virus, which is spread through the air when an infected person coughs or sneezes. Measles typically starts with a fever, cough, runny nose, and red eyes, followed by a rash that spreads all over the body. The rash usually appears a few days after the initial symptoms and lasts for about a week. Measles can cause serious complications, particularly in young children and people with weakened immune systems, including pneumonia, encephalitis, inflammation of the brain, and even death. However, measles can be prevented with the measles vaccine, which is safe and highly effective. There are two types of measles. Standard measles, sometimes known as red measles, or hard measles, is caused by the rubeola virus. German measles, also known as rubella, is an entirely separate illness caused by the rubella virus and is usually a milder infection than standard measles. Red measles is another name for the typical form of measles, which is characterized by a combination of symptoms, including fever, cough, runny nose, red eyes, and a rash that spreads all over the body. The name red measles comes from the characteristic rash, which is red and blotchy and starts on the face and neck before spreading to other parts of the body. Red measles is the most common form of the disease and is caused by the measles virus. It is highly contagious and can be spread through the air when an infected person coughs or sneezes. Red measles can cause serious complications, particularly in young children and people with weakened immune systems, including pneumonia, encephalitis, inflammation of the brain, and even death. However, red measles can be prevented with the measles vaccine, which is safe and highly effective. German measles, also known as rubella, is a viral infection caused by the rubella virus. It is a milder illness compared to red measles and is typically characterized by a rash that starts on the face and spreads to the rest of the body, as well as a low-grade fever, headache, and swollen lymph nodes. German measles is highly contagious and is spread through respiratory secretions, such as coughing and sneezing. The virus can also be transmitted through direct contact with an infected person or by touching surfaces contaminated with the virus. The rubella vaccine is highly effective in preventing the illness, and widespread vaccination programs have helped to greatly reduce the number of cases worldwide. However, rubella can be serious for pregnant women, as it can cause birth defects in the developing fetus. Women who are planning to become pregnant should ensure they are immune to rubella through vaccination or by having had the illness previously. The symptoms of measles typically appear about 10 to 14 days after exposure to the virus and can include high fever, cough, runny nose, red, watery eyes, conjunctivitis, sore throat, Koplik spots, small white spots with a blue-white center on the inside of the mouth, a rash that appears on the face and spreads to the rest of the body, including the trunk, arms, legs, and feet. The rash usually appears several days after the initial symptoms and may be itchy. There is no specific treatment for measles, but supportive care can help relieve symptoms and prevent complications. Treatment may include rest and fluids. Getting plenty of rest and staying well hydrated can help the body fight off the infection and ease symptoms. Medications. Over-the-counter pain relievers such as acetaminophen or ibuprofen can help relieve fever, headache, and muscle aches. However, aspirin should be avoided in children with measles due to the risk of a serious condition called Reye syndrome. Vitamin A. Children with measles who are vitamin A deficient may benefit from vitamin A supplements, which have been shown to reduce the risk of complications and death. Complication management. If complications such as pneumonia or encephalitis occur, hospitalization and supportive care may be necessary.